I'm Chris Hajnik. I'm an orthopedic surgeon, and my primary focus is adult hip and knee reconstruction. Early on in life, I wanted to be a doctor in general, but it wasn't until high school that I really focused on orthopedic surgery. I injured my knees, and at that point in time, I knew that orthopedics was the only field for me in terms of medicine. The interesting thing about my knees is that when I look at my x-rays, they look worse than many of the x-rays of my patients. However, I've maintained my knees through conservative treatment plans. I don't do high-impact exercise. I take care of them because although they are radiographic candidates for knee replacement surgery, I'm too young to expect that a knee replacement at this point in time is going to last me the rest of my life. Patients that we see here in San Diego are a fairly active bunch. They are pretty demanding on what their expectations are pre and post injury, pre and post surgery. So it's important for us that treat these patients for arthritic conditions that we present them with reasonable expectations how their life will change following, say, a joint replacement surgery. The typical trigger that's bringing someone into my office is pain that is diminishing their functionality. There are things in their life that they like to do and they no longer can enjoy those activities because now whenever they try and engage in a sport, say golf or tennis, they're faced with pain, and it takes longer and longer for them to recover. Well, my goal is a happy patient, and I will use whatever means necessary in order to achieve that goal. So the first thing that I want to do is I want to understand what the patient's complaint is, what's driving them to come and see me. So that involves 5 minutes sitting down and asking them questions and hearing what their symptoms are. Then I proceed with the physical exam to see if I can correlate their symptoms with what I'm finding in the office. Finally, I'll layer on top of that x-ray findings. If everything matches and gels, then I believe that I'll be able to treat them for their hip or their knee pain. I think knowledge is always important for a patient when they're making a decision such as a joint replacement. So I welcome patients to seek second opinions, and I provide them myself. As long as all the conservative treatments have been exhausted at that point in time and I feel that everything correlates, then I think it's reasonable to proceed with a joint replacement if there's no other option. Patients that have severe pain who undergo a hip or knee replacement should expect that that pain will be diminished significantly and they'll be able to get on with their life, be able to regain that function that they lost. These surgeries represent the greatest surgical advancements that we've seen over, say, the past 40 years, at least in terms of orthopedic surgery.